This has been a debate for a long time of whether women with polycystic ovary syndrome are at increased risk for type 2 diabetes because of the disorder, or whether it's due to their increased risk of obesity, and whether there's ethnic variation, because the original studies showing a very increased risk for type 2 diabetes in women with polycystic ovary syndrome were done in the United States, where we have our obesity epidemic, and over 80% of the women are obese, and about 40 to 50% of those women have impaired glucose tolerance, and about 10% of them already have type 2 diabetes. But particularly in Europe, where they're less obese, and in Australia it's been less clear. And so one of the important abstracts that was presented at this meeting was a very large cohort study from Australia asking the question, what's the incidence, the actual development of type 2 diabetes in women with PCOS, and is it all just obesity? And the answer is that the incidence is increased and it is not related to obesity. So I think that that's very, very important to see in another part of the world that's not quite so challenged with obesity, that there is still very high prevalence rates of type 2 diabetes in PCOS, and that it's independent of obesity. And this is on a background of a study recently from Scandinavia showing significantly increased risk for type 2 diabetes, about fourfold increased risk, and at a significantly younger age. So I think that's important for clinicians to know. They really should be screening their patients with PCOS for type 2 diabetes. And there's other recent data suggesting that the best form of screening is not a fasting glucose or hemoglobin A1C, but a 2-hour post-glucose challenge glucose. So I think that's another very important take-home message for physicians, is how to screen, which is with the glucose stimulated 2-hour value rather than with the hemoglobin A1C. Another presentation that I found very interesting was looking at the prevalence of type 2 diabetes in adolescent girls in a population-based study in a busy New York medical center, and finding 20% of girls and adolescents had impaired glucose tolerance, those with PCOS. So I think that these add much more support to being concerned about type 2 diabetes risk in PCOS.